Hello and happy Wednesday. I was going to say good morning, but I think it's already the afternoon. I wanted to do a quick video on scar tissue management, kind of going along with our blog this week about mommy makeovers. And of course, anytime you make an incision in the body, there's going to be some risk of developing scar tissue. With tummy tucks, there's a little bit more scar tissue because it is an incision from hip to hip. So quite a few of my patients who come in to see me have quite substantial scar tissue in their lower abdomen. So a couple ways you can address this. You'll notice if you pretend this is your lower abdomen, if you were to pull up just a little bit down here, you would notice that where the scar tissue is located, it's not very mobile. It doesn't move. So what you can do, a couple of methods. You can do scar rolling. So again, let me mark my arm here for you guys. So if you have a scar right here, can you see it? All right. Then scar rolling is you would do your best to get that scar in between your thumb and index finger, or whatever's comfortable. It could be your middle finger, it doesn't really matter. But in between your thumb and another finger, and you're just gonna roll it back and forth like this, okay, along the length of the scar. And when you're doing this, you wanna make sure that you don't have any lotion, your skin isn't slippery, that it's nice and dry. Another method that you can use, so that's scar rolling, there's a scar stretching method, and you pull. So you kind of start right where the scar is, and you pull away from it on both sides, and you do that down the length of the scar, like that. And then you can also go this way, over the scar, like that. And basically you're just trying to break up that adhesion. You can also do a scar massage. So you take a finger and you just rub circles, and you're trying to get that mobility, that movement back in the tissue, because it's not going to be this tissue on my arm. I don't have a scar, so it's very mobile. You see how that line is moving down? You'll see with an adhesion, a dense scar, it won't move. So those are three ways that you can start to work on that scar tissue and to get the mobility back. You can also, when you're done with that, with the rolling and the stretching of the scar, you can apply, we use CBD balm on our patients. That helps with the density of the tissue as well. And even if you like essential oils, even lavender can be good for scar tissue. Of course, frankincense, that's a much more expensive essential oil, but that one's good for scar tissue as well. So the reason why I am concerned with scar tissue with my patients, and I want to make sure that there's good mobility, is because scar tissue, I always describe it, if you're from the South, you'll know what I'm talking about, but there's a vine in the South called kudzu, and it's a beautiful green vine, but it takes over everything around it. So big trees, buildings, everything. It grows very quickly, and it totally just takes over, and it suffocates what's underneath. So if it's a big tree or other type of greenery, it kills it because it doesn't allow that greenery to see the light of day. That's kind of what scar tissue does. It grows, it proliferates, it grows fast, and a lot of times it grows strong, because that's what scar tissue is supposed to do. And when you have an injury, your body says, oh, I've got to go send reinforcements, build tissue that's strong and dense because this area is weak. So your body's just doing what it's supposed to do, but sometimes it kind of gets out of control. So that scar tissue, you may have it, I may have the scar right here, and this scar is very dense, but it's also impacting what's underneath, those tendons that allow movement, and it can start to restrict those. So same thing in your abdomen, it can really start to restrict those internal organs down there and start to cause pain, difficulty with bowel movements. There's a lot that it can start to impact. So you want to make sure that you break that scar tissue up. Okay, I will see you guys tomorrow. I hope you're having a great day. It's middle of the week. Yay! Bye.